I'm Star Parker, and it's been more than 19 months since we first learned that our nation was in a worldwide pandemic, the coronavirus 19, and it has since caused the death of more than 677,000 Americans and almost 5 million people worldwide. President Trump's Operation Warp Speed plan brought a few vaccines to the market in record time. And by early summer 2021, 3/4 of Americans had been vaccinated, and the whole country began to come alive again. But then a Delta variant. Oh boy, a Delta variant of COVID sent President Joe Biden's declaration of a summer of freedom into a summer of an alarming round of highly contagious new cases, hospitalizations, and deaths. So what was President Joe Biden's plan? Mandated vaccinations and relentless shame and blame of the unvaccinated. On September 9th, the president announced that all federal workers, government contractors, and all employers with 100 employees or more had to be vaccinated. And the concerns of taking the vaccination of Black people in the country started hitting the headlines after that announcement. The unionized media wanted us to believe that it was only MAGAites and Trump supporters who were suspicious of the new vaccines. But African Americans had had hesitations all along, yet their concerns were kept under the radar until President Biden's new forced vax mandates, and then New York City became the first major city to force vax proof before being allowed to eat inside a restaurant or to enter into a public facility. Well, these edicts aren't going so well for Joe Biden, nor for the mayor of New York, as African Americans are being segregated and forced out of the federal workplace and out of public spaces, including restaurants. A scrimmage at New York City restaurant that went viral, it lit Black Lives Matter to take to the streets what Blacks had been venting about behind closed doors. I was there in New York City September 11th, and that weekend, which was the first weekend of this new vax-proof edict, and I saw firsthand the disparity. The vaccinated inside, the unvaccinated outside. Without a vax card, folks were not getting in, and those folks were disproportionately African American. Rapper Nicki Minaj found out the hard way that no one is allowed to ask questions of the elite, of their politicians, or of their scientists. Anyone who dares to even think about, talk about the side effects and ask questions about them, they get canceled or shamed. Yet there are a lot of questions that people of all races, all ages, and all affiliations have about the vaccine. And they're wondering now about why this rush? Give us time, we're talking health. They have questions like, why does someone have to get the vaccine if they have already had COVID and now they have a natural antibody? Or what about the side effects of those with pre-existing medical conditions? And they may be taking a variety of medicines and they don't know how this is going to affect that medicine, and the doctor can't tell them more detail. This is creating a problem. Why are the so-called medical experts and the pharmaceutical companies that are producing these vaccines so hostile to natural or time-tested drugs that some doctors say are effective in treating COVID-19? Record numbers of Americans are now seeking information about religious and or medical exemptions as the Biden administration rushes to get people forced vaccinated. But the government has very limited answers for them on questions about religious and medical exemptions. Yet these are the same politicians that are pushing to not allow the unvaccinated to work, not to fly, not to go to their favorite concert or restaurant. So we have to talk about this. We have to talk about the vax today on Cure America. And I have an amazing guest, a doctor, a medical doctor, Dr. Robin Armstrong. He practices internal medicine in Texas, and he's the owner of the Armstrong Medical Group. It's a group of hospitals and nursing homes. They have physicians in there, nurse practitioners, the physician assistants. He's very, very well established in the medical field. Dr. Armstrong has been involved in all levels of hospital leadership, including the board of directors of a local hospital there in Texas. He's been president of the medical staff, chief of staff, chair of internal medicine. So he has tremendous insight on many things that are important president on this issue in particular, what we should be thinking about regarding COVID, what we should be thinking about regarding this vaccine. We're going to talk to him in detail. We're then going to talk to my great panel of experts that will again help us sort through the noise of this troubling news to find some truth. So stay tuned. We've got an important discussion right ahead after this.
It's time for a cure. CURE is a coalition of new voices with new ideas that will become new policies. We are the CURE, the Center for Urban Renewal and Education. Headquartered in Washington, D.C., CURE works with churches, political, and business leaders on behalf of urban communities. CURE's mission is to address issues of culture, race, and poverty from a Judeo-Christian perspective. CURE. Join with us. There has never been a better time to help Black communities.
My very important special guest, Dr. Robin Armstrong's resume is so long that I am posting it on our curepolicy.org website for you to get the fullness of who you're going to be hearing from right now on this incredibly important issue, mandated vaccinations. Doctor, thank you for being with me.
Thank you for having me.
Yeah, we haven't seen each other in quite some time, but you've been very, very busy, especially as a medical professional. This is unraveled very quickly. We've moved from March 2020 that a deadly virus has loosed from a Chinese lab to worldwide deaths, political games, mandated shutdowns, muzzled medical professionals, government bailouts, and now forced vaccinations. People are very afraid. Now we're afraid. Now people are afraid of each other. People are afraid in their families. People are afraid to go to work. They don't know what to do. They don't know what to believe. So help us, doctor. Walk us through this. Let's go all the way back to the beginning. And thank you so much for taking your precious time to be with me in studio today.
Yeah, it's great. Thank you for having me today. March of 2020, the pandemic started. We were, as medical professionals, extremely concerned about what was happening because we knew that there was a potential for a lot of deaths. We had seen what had happened in China and Italy, over in Europe. And so we were very concerned about it. And so what happened with me personally is I'm a hospital physician. I take care of patients in the hospital, take care of patients in nursing homes as well. And so we were able to treat a group of patients. We had an outbreak in a nursing facility in early April. So early April, late March 2020, we had an outbreak in a nursing facility. And at that time, we decided to treat them with hydroxychloroquine, azithromycin, and zinc.
And this is in Texas. This is before everything started really finding out exactly what was going on. You were starting to see people show up saying, we're really sick.
Absolutely. And so we had an outbreak in a nursing facility, and we were pretty scared because we were afraid that we were going to see a lot of deaths because this is the most vulnerable population. So we treated them, and we had great success.
And this was with the hydroxychloroquine that we started hearing about before this whole, we're going to come up with a vaccine, before the pharmas got involved. You as a medical professional and other doctors were already saying, what can we do with what's available? Is that what I'm hearing?
That is exactly what happened. And so there had been studies in China and France that said this drug combination was effective. Started treating people and had success, but we were attacked. And so this was very unusual for me.
Now, you said we were attacked by the medical society?
Oh, my goodness. We were attacked by the media. There were national stories out at that time condemning what we had done. And as a I've been involved in politics for 30 years, but I've always kept my medicine separate from politics. Now, when we were attacked by the media, the Rolling Stone magazine did an article on us. The New York Times, the Washington Post attacked us, and it was we were confused.
Using a drug, if you will, that has established history of working on a variety of different areas where people may have ailment. So now you're starting to see this outbreak of a virus that we still knew little about. You're back in March, April last year. You're using this. We did start hearing in the grassroots about this hydroxychloroquine. I think even the President Trump mentioned it, and we saw publicly that attack even against him. Why wouldn't the whole industry want any and all things to be done at that time when we started seeing such record numbers of deaths, including, as you mentioned, in that population that was so vulnerable?
Well, that was confusing to us as well.
Okay.
We wondered why.
Really?
I at the end of the day, months later, I figured out that I believe that there were large stakeholders that needed a pretext to change election law. They needed a pretext to shut down our churches and shut down our schools.
You gotta be kidding. This is
and I really believe that is the only reason why we would be attacked for treating people, and the treatment was successful.
Well, okay, so now you were in Texas. During that same time, if I recall, in California, they were actually mandating that doctors could not use this medicine. Did it get to that place with you? Because even though you're seeing these attacks from the media, you're a medical professional. You had to continue your practice, and especially with what you knew worked. Was there a pressure from the industry itself to say you cannot use hydroxychloroquine?
Well, I was actually investigated by the medical board. Someone made a complaint.
Oh my!
It was an anonymous complaint. And so the Texas Medical Board did an investigation that went on and kind of was over my head for 9 months, and eventually it was dismissed. But cost $40,000 of legal fees and defending myself, and so the bureaucracy was against this.
Okay, but why? You mentioned there's a political fallout, and we know that, and especially now with the elections. But and then I've heard and seen some other interviews that you've done to say that even Dr. Fauci and the professionals that were around the president at the time may have given us information that to lead us down a path that perhaps even created more of the tension and now the fear we're seeing today.
Absolutely.
Tell us a little bit about that.
Well, I think Dr. Fauci and the bureaucrats at the FDA and the CDC and the NIH, those organizations all created an environment. It seemed like they wanted a particular outcome to us. It seemed like they wanted to push these vaccines. It seems like they wanted to push, all the mandates, the lockdowns, the masks. This is what they wanted to push. Dr. Fauci himself in 2005 said that chloroquines were effective against SARS-CoV-1 at the time.
This was in 2005. This is when we were dealing with other types of what they now call coronavirus.
Absolutely.
I think that most Americans didn't even know there was a such thing as a coronavirus. I know that it even caught me off guard because I didn't know we had such a SARS outbreak. We did not have to all deal with it. So I'm just wondering, and I suppose that I'm leaning toward the fear with others that, is this really political? Because why all of a sudden we all had to be tracked one way?
Right.
And in particular now, to the place where it could cost you your job if you don't get a vaccination.
Absolutely. And I believe not only that, it can cost you your job if you don't get a vaccine, but it can cost you your life. There are effective therapies out there now, like hydroxychloroquine and ivermectin, and you take the zinc and the vitamin D supplements. There are things that people can do. The Regeneron the monoclonal antibody therapy is something that's out there that's not talked about much.
But why? Because even in the Black community now, we're looking at fear embedded in the Black community that, whoa, now the heavy hand of government is going to force us to do something that we have serious questions about. And we know that a lot of the medical concerns of African Americans are because of the deficiencies in zinc and especially vitamin D. We don't hear enough about that. And we know that the FDA suppresses information about the vitamin world, if you will, to make sure that Big Pharma continues down, their economic interests. But we're talking death now. Now we're talking job. Now we're talking can't go to church because we're shutting everything down. But other things can be open. I'm just hoping that what I'm hearing from you is not true, that there's a driving conspiracy almost behind where we are today. What would you say to people that are afraid to even, and not even, I don't want to get to the fear yet. I'm concerned about those that have a HIPAA open door to have to tell their boss that they have pre-existing condition, that they have to, who wants to tell your boss, guess what, I'm HIV, so I can't take the vaccine, but can I please still keep my job? This is serious stuff. Right,
well it is. There are all sorts of issues with this, and unfortunately, I'm not a conspiracy theory either, but it seems like there has to be a hidden motivation behind this. other than trying to make people well. My desire is to make people well. It seems like the overriding desire is to push the vaccine. The overriding desire, at least a year ago, was to change election laws. The overriding desire back then was to lock down our schools and our churches. And so I don't understand why that is either, because there seem like there are things we can do as a society. Right. We should not be pitting Americans against one another, the vaccinated and the unvaccinated. Number one, a lot of things that the president said in his speech was not true about it being a pandemic of the unvaccinated.
You're talking about now President Biden.
President Biden.
You know what? I want to, let's get into that a little bit. And I want to, I'm going to bring in my panel and have them sort through some of this with us, just to get to the health questions about can we get those exemptions, to get to the religious questions. Can you? I mean, New York just said, well, too bad, we don't care. You're not working if you don't get a vaccination. But I want to come back to you after my panel to discuss with you as a man of faith. I need you to speak into this moment because the fear is mounting as a result of not knowing what to believe. Sure. I'll be right back after this. Well, Dr. Armstrong sure gave us a lot to think about on this very important topic of forced vaccines, COVID-19. So now I want to go to my panel of experts to get deeper into this discussion. So I have Horace Cooper with me again this week. Thank you.
Thank you.
Yeah, Horace is with Project 21. I told you last time he's actually at the National Center for Public Policy Research, and he's on their advisory board as well. So thank you for, and then you write a lot too, so people can kind of follow much of your work, including your book that you have out on the marketplace. And thanks for joining us, Rick Manning. Rick is the president of Americans for Limited Government. He's co-author with me on Necessary Noise, and you've been writing a little bit on this. Got in some hot water, because I think you're one of the first ones to point out that this is going to backfire on New York to start selectively saying the unvaxxed have to stay outside, and when you look at how many blacks were unvaxxed.
Yeah, they've chosen a fight they didn't realize that they were getting into.
Yes, fun to watch that one. But we'll have to get more involved in it after I introduce my third guest and my special guest, your first time.
Indeed.
Roger Severino. Did I do it?
It was good. Italian background, but I'm Hispanic.
You know, every time I think about Italian background, I think about fashion when I see more than two letters in the last name. And I wonder, okay, so if you made a fashion line, it would be easier for me to pronounce because I love Italian.
That's great.
But I got it right though, right? But your background is Hispanic.
That's right.
So you must have a whole lot of interesting thought about some of the issues that are going on right now, in particular how it breaks down on these racial, what they're now calling people of color. But let me tell our audience a little bit about you since you weren't here before. Senior fellow at the Ethics and Public Policy Center. You direct HHS Accountability Project there. You were actually at the Office of Civil Rights over at HHS, which is the Department of Health and Human Services. Some of our audience might not know the alphabet soup that we talk about or talk through out here, but you also specialize in civil rights. You specialize in some of the concerns that we're hearing from people about, you know, health exemptions and religious exemptions, and what are we supposed to think about as now the president of the country is saying, we're going to force you to have a vaccination or you're not going to be able to move around. What are your thoughts on some of this?
It is unprecedented, especially at the federal level, because President Biden has said every business with over 100 employees must have their employees be vaccinated, right? We have not seen this level of federal oversight over people's individual health before. And the interesting thing, they're looking at regulations for workplace health and safety. So when you go to a construction site, and there are some regulations that say people have to wear hard hats on a construction site, right? Now they're using that same authority to say, well, now businesses have to vaccinate, and people have to get, you know, involved in the medical decision-making of employees outside of the workplace. So it's a real stretch of federal power to say that President Biden has that authority. In fact, he said he didn't have that authority just a few months ago, but how things have changed in such a short time.
They have changed, and I think that even as an employer myself, much concern over invading our employees' privacy, to start having to ask them about their health conditions and the violations to HIPAA law. What happens if they get vaccinated because I forced them and then they get sick? Whose insurance is going to pay for this? There are so many unanswered questions. And so I think that, Rick, when we think about what is going on now, we mentioned in the introduction that it's breaking down a little bit racially, and they're getting into a fight that they weren't expecting. BLM showing up at the door of a restaurant was not anticipated of the Biden administration, but they're falling apart in a whole lot of areas. In fact, I might want to ask you, Roger, about what's happening at that border, because that's coming up too. They're not vaccinating these guys, but everybody else is being forced to vax. So tell me, what are your thoughts on it? What should people be thinking about as employers are now put into position to say, I have to get involved in your health question?
Well, let me be clear. I did work at the Labor Department under George W. Bush. I did communications for OSHA. I have some knowledge about OSHA law, a little bit, enough to get in trouble. But here's what people don't realize. OSHA is constitutionally authorized under the Commerce Clause in the Constitution. The Commerce Clause in the Constitution was a central point of the Obamacare decision that John Roberts wrote back, and a lot of us were upset about it. But here's what he did about the Commerce Clause. He said that the Commerce Clause could not be used to force health decisions under Obamacare. So the Obamacare decision actually directly relates to this decision, because OSHA, authorized under Commerce Clause, cannot do, based upon the Obamacare decision, what Joe Biden is telling them to do.
Okay, but the problem that we're going to run into, and may already be running into, especially up in New York, is that those are court decisions. That means now we have to go through the courts and say that, but the court already ruled on this, that you can't force people to do this, but yet people are losing their jobs.
And only about 7% of the employers are saying they're going to enforce it. What I would tell an employer is wait until it's legal. Okay,
Yeah,
don't enforce something that is most likely not legal, and because the fact of the matter is, if the downside of enforcing it, losing 10% of your workforce in a time when you don't have labor in the workforce to replace them with. The downside of not being able to offer neonatal care in a hospital because you've gotten rid of all your doctors and nurses who don't want to be vaccinated. Those downsides far exceed the upside of the vaccination. And as a result, I think a reasonable corporation can say this is an likely unconstitutional mandate, and until it's proven in court, we're not going to follow it.
Well, I don't know, with all these woke corporate leaders these days, they might just go ahead and follow it anyway. But Horace, we're talking about also federal workers. It's one thing when you're saying this is a private corporation, this is even a public corporation, so we might have a little latitude. But Black people are disproportionately in federal employment. Black people are disproportionate up in New York, not getting the vaccine and working in the restaurant business. And they're starting to lose their jobs in both places because they don't want to be forced into a vaccination. What should we be thinking about on these headlines?
Well, a couple things. One, I agree with Rick. When I used to teach constitutional law at George Mason University, we talked about the Truman case, the case in which President Truman, as part of the effort for the Korean War, thought that he had the presidential authority to take over a plant and operate it as a federal entity for his purposes, for war-making purposes. It was a legitimately authorized war, but the Supreme Court ultimately determined that he did not have that authority, and they laid out their test for what kinds of actions a president may have when it comes to the kinds of new areas of expansion. Rick is correct that the Department of Labor is actually going to have to go through a rulemaking process. The president sort of preempted that by talking as if that had already occurred. It has not. To use a war metaphor, Colin Powell said, you break it, you own it with regard to Iraq. If a corporation moves forward with this kind of measure and there are consequences and it ultimately is not found to be constitutional, they are going to own it.
They own it, okay.
In New York, we are now seeing this differential take place along racial lines where people are finding out that you can actually be told you're not welcome here. And if it turns out it's disproportionately Black, The woke left is saying that's okay.
The woke left are saying that's okay, but Roger, is it okay? You're civil rights. You were in the office of civil rights.
That's right.
What's going to happen here?
And we enforce laws based on a disparate impact standard, which has been accepted by various courts. That has been a primary tool, usually from folks on the left, who've been using disparate impact for legal cases.
Right.
Well, if you think about the vaccine mandates, if you have a disproportionate effect, where mostly African Americans and Hispanics are the ones that are lagging behind on the vaccination compared
Or
to
the
whites.
Hispanics lagging a little bit too? Okay,
The most recent numbers, actually, Hispanics are behind African Americans.
Oh,
It's
wow.
flipped in the most recent.
Okay, go ahead.
So if you have any rule where you have a really draconian punishment, you get fired if you don't follow the rules, and you affect minorities more than whites, that instantly raises a red flag, and it could lead to claims against the companies for discrimination. However, they're going to say the government made me do it. The government made me do it, and that's where it becomes more complicated. It's the government that's pushing
the
it.
government, because the government is the one that has the civil rights offices, are they going to police themselves? I mean, this is a Biden administration. And
That's the fun part, okay? If you get down to it, the left has been pushing the disparate impact theory for quite a while. The courts have ruled that if 40, it can't be, unless there's a majority of finding that there's other intent. Disparate impact, outcome-based discrimination, saying 10 blacks are affected for every 3 whites are affected. That kind of legal determination can't be the majority. There has to be other findings. The challenge that the left's going to have, the challenge that DOJ is going to have, is they're going to have to make the case that against disparate impact in the courts. And by making the case against disparate impact, they're going to contradict everything the left has been saying about the need to do outcome-based determinations under law. That destroys them.
Well, it does destroy them, but later on. In the meantime, I mean, I know that this is news to me that the Latino community is saying, we're not doing this vaccine thing either. We have other questions as well, but they're more disproportionate in the gig business, in the, in the private sector, whereas you have Black people who are more working for government. They work for feds, the state, the county, the cities, and the post office. I think they exempted out a little bit. So I'm just wondering, prior to the point where we could be going, which is good news, that we could, in the face of all this liberal obsession with race and disparate impact, what happens to the individuals? They're losing their jobs. They're getting notice. I have a relative who told me on November 1st, I better have done this, or I'm going to lose my job. And there are side effects that people are concerned about. Let's talk a minute about why they're not vaccinated. Maybe I should start over here with the Latino community, because that is news. What's stopping it? I don't want people to tell, it's because they're breaking the border. No, that's not the border breakers. These are people that live here, their generation here. They have questions. What are some of the questions?
I think there's legitimate questions as to the need, especially if you're young and healthy. Right? But secondarily, I think it's ultimately a lack of trust. The issue has been so politicized that people just start tuning out. And if you have that breakdown in trust of government, then people are going to think twice about doing something that is being mandated. And remember where this all started, the doubts about the vaccine. Under Trump, it was called Operation Warp Speed. And folks on the left said, whoa, you're going too fast, it's dangerous. The very first notion that the vaccines would be dangerous actually came from people criticizing the left, from the left to the right. And now that the government has switched, now you see the opposite effect. So you have criticisms. It's whoever's in power gets, you have the suspicion. So you have that breakdown of trust, I think, is a big explanation.
So did the messaging go out to so the Latino and Black community heard these messages from the people that they vote for, tell them, don't you trust this?
Originally.
And then when Biden came into power, all of a sudden, trust this. And now we've gotten in 3 months toward, we're going to force you. We're not hearing necessarily from the Latino community, I suppose, because they're just a quieter community and that we're not seeing this impact. But Blacks are speaking out now, Horace.
So this brings us back, and I know it may sound complicated, but this brings us back to the disparate impact theory. Here's what's really going on with the vaccine. Working class people, blue collar type people, are disproportionately likely to want to take the vaccine. Blacks and even Latinos make up a substantial number of that working class. That working class blue collar community are made up of people who rightly think that they set their own fate, that they decide what's going to happen in their homes and their livelihoods. And even if you look at surveys and you start looking at income, training, career, what you start seeing is the very group of people that are most skeptical, not just of the vaccine, but of the Biden administration, of government, and of the woke agenda, are really this working class blue collar.
Isn't that amazing?
And that is going to come back and really hurt the left and the woke, because they're losing these people rapidly.
They were losing them rapidly. We saw it in California. They was the Latinos are slipping away. But yet, Rick, they kept blaming the MAGAites, and I think that gets to your question of trust. They keep saying, "Oh no, these are people that are these are the MAGAites. These are the trumpets. They don't want to do it," and yet they're really the people that are.
Well, that's the ultimate irony. Many of the people who are dead set against getting a vaccine, or dead set against being told that they have to get a vaccine, are people who are, doesn't matter if they are black, Hispanic, or white, they're people who believe in self-determination. They believe in the American dream, and they're saying, you can't tell me, I don't care if it's Trump or if it's Trump or Biden, you can't tell me to do this.
That's right. It's just inconsistent. But I want to talk a little bit about what some of those concerns are. I'm going to talk to Dr. Armstrong a little bit more to find out the legitimacy of some of these questions. There are questions and there's suspicions on why the government feels they don't even have to address them. They don't have to answer them. They can just shame anyone that has them. And we'll get to Dr. Armstrong and then back to my panel right after this.
It's time for a cure. CURE is a coalition of new voices with new ideas that will become new policies. We are the CURE, the Center for Urban Renewal and Education. Headquartered in Washington, D.C., CURE works with churches, political, and business leaders on behalf of urban communities. CURE's mission is to address issues of culture, race, and poverty from a Judeo-Christian perspective. CURE, join with us. There has never been a better time to help Black communities.
Some feisty conversation with that panel. I'm so glad that Dr. Armstrong stayed with us so that we can sort through a little bit of even their news and their noise so that we can discover some truth on this issue. Thank you, Dr. Armstrong, for staying with me. You're a man of tremendous faith in Christ. You and your beautiful wife of 22 years, Martha, have 4 sons who their names read like a Sunday school lesson, historical lesson of warriors, Daniel, Gabriel, Joshua, Noah. Speak to this from a Christian heart. We're afraid. Speaking to this moment, people are rallying now. They're afraid. They don't know what to do. Now it's vax or lose your job. Now it's racial separation because I was just in New York, and as I mentioned earlier, and Black people are sitting outside eating while white people are inside because record numbers of African Americans are saying, I just don't know about this and I need more information before you now force me to do something I don't want. And these are the people that voted for President Biden.
Absolutely.
And then the political separation, this is about red people, this is about MAGAites, this is about Trump. We know it's not true. This is a lie. But we're now divided on the scale as in the 60s.
Right.
Where's this leading us, and how do you speak to this as a Christian so people say, okay, I can trust that pastor part of the doctor?
Right. You know, what I would say is that we should not be making decisions based on fear. You know, that is the number one thing I would say. And so the scripture says that God's not given us a spirit of fear, but a spirit of power and love and a sound mind. And whenever we make a decision based on fear or based on pressure or someone putting pressure on us, oftentimes that's not the right decision. And your medical decisions are the same way. No one cares about your health more than you do. So what I would say is make sure that you educate yourself, make sure that you pray, make sure that you not be forced to do anything, even if it comes from some bureaucrat telling you it's the right thing to do. Make sure that you're wise. There are certainly, situations where the vaccine is reasonable if you have lots of risk factors, but we don't need to vaccinate every individual. There are things that you can do if you choose not to be, and that's the better way to go about this. As a public health official, Dr. Fauci, the better way to go about this is say, if you choose not to be vaccinated, then you should take prophylaxis with hydroxychloroquine, ivermectin. Make sure you take vitamin D. Make sure you take zinc. Make sure you lose weight. Make sure that you control your diabetes. These are things that over the last year and a half, we could have had a significant impact on our community, on the Black community, had we just taught those things.
You're absolutely right. In fact, Jerome Adams, he spoke at our Cure Policy Summit last year. We bring clergy to Washington, D.C. to have discussions on various issues impacting our most distressed zip codes. And he said those very things. He said why we're seeing disproportionate number of African American die is not directly because of this COVID. It's because we need to be concerned about ourselves and other health issues. So you mentioned just a moment ago that no one's more concerned about their health than you. Well, tell that to McDonald's. I mean, come on. Now we know that that people are not being concerned. So is this an opportunity for individuals to check ourselves for personal responsibility? Is one of the lessons that we could get out of this whole year and a half of COVID is to say, how am I eating? What am I doing?
Absolutely.
What can I do to be more responsible? I'm hoping that could be one of the outcomes if we can sort through after the noise of this whole political tension. Do you think that people going to come out of this and say, yeah, maybe I need to think about it? Because at the same time, we're dealing with, expansions of Medicaid, expansions of Medicare, and all these other things to where you put the responsibility on government and taxpayers. Maybe that's why a lot of people don't care about themselves and their health.
As a healthcare professional, that has been the most disappointing thing, because we knew this a year and a half ago, that people who are obese, people who are diabetics, we knew that they were very high risk.
How about smokers? Is that in that category too? Because I want to see the data.
For this disease, smoking really has not been a big risk factor for this. It's very unusual, but it has not been. So people with chronic lung disease, they certainly have less reserve, but they haven't been a big target.
So it is impacting a certain type of ailment, if you
Absolutely.
will. And now we're not hearing about that either. We're just hearing that all of us are at risk all of the time.
Right.
Don't trust anyone you're ever near, including your own family, until you get vax. And now, because so many of you didn't vax, we're going to force you to do it.
Right. That's the way you said it is exactly how it's being presented, and it's wrong.
It is wrong.
It's immoral.
It is immoral.
And it's wrong to do that to people.
And I think that my position on it, doctor, and correct me, and especially as a Christian man, don't let me get too angry, is that we're hearing all of this, you better do to save other people's lives, from people that believe in euthanasia. They believe in infanticide. They believe in abortion to the 9th hour, ninth month. How in the world can you tell me on one hand you're so concerned about death, and on the other hand you're looking for ways to kill people, including to leave abortion clinics open and close churches during the beginning of this virus? Help me sort through this.
Right, absolutely. Well, it's politics. It's politics for them. It's about power and money, and power and money. And how one group is saying, how can we expand our political power? There's a group of stakeholders there. Listen, big business, big tech, and big corporations have made billions and billions of dollars off of this pandemic.
Big Pharma is right.
Big Pharma, part of the big corporation, made billions and billions of dollars during this. The government bought all the stockpiles of vaccines even before they were proven effective.
Oh my goodness.
That's not any way to do a study to have it already purchased and saying this better work. You're going to get a biased study. These vaccines, it's shameful in the way that this has been rolled out. It's really shameful, and I think we should step back and say, make use of those opportunities and say, listen, if you control your diabetes well, if you get on a diet and lose weight, your survival rate during this pandemic is going to go up.
Yeah, but how do you get that message out? As you mentioned earlier, the media tried to shut you down immediately.
Right.
And not just you, all of the doctors that were saying, hey, wait a minute, there are alternatives. So now we didn't even know to believe our own doctors when they said, no, let's do some other things. Then, as I mentioned earlier, California, no, you're not even going to let the public know that these things are available, or you're going to lose your license. How do we get that messaging out? How do we break through the fear and let people know that they can exercise their faith? There are things they can do personally to get a hold of this in their own lives, so that we can start living free again.
Well, I'll tell you, we do it with shows like yours. So thank you very much for having us on. We do it by personal. American Frontline Doctors has a plan to get the message out. We filed lawsuits. Physicians are spreading it via some social media revenues or ways that we have, avenues.
The American
that we have.
Frontline Doctors, those are the ones that came here to Washington, D.C. that
Correct.
tried to make their voices heard, and then they got shut down.
And we sent, and so there are some large, folks who have a lot of influence who are starting to help us get that message out.
Okay.
And so we're going to start pushing that message out more and more. Right. With God's help, we're going to get it out because it's important. I mean, it's going to save lives.
It's going to save lives, and it's actually going to save freedom.
Absolutely.
Because what we're hearing now, and I'll get into a little bit more with my panel, is that's what's really at risk. If we don't even have the freedom to make health decisions for our lives, or it's going to cost us where we're going to work or how we're going to move, it brings the revelation into the now. And I think that concern is legitimate, that
Absolutely.
we're getting to the place that a political party, the Democrat Party, would insist that you're not even going to travel if you don't do what we tell you to do.
I believe that the healthcare bureaucracy is what will enslave us if we're not careful. The healthcare bureaucracy. I believe bureaucracy is evil. Ronald Reagan says as government expands, liberties contract. Right. I believe that the bureaucracy, so it's going to be a nameless, faceless person who we never see, who is going to write rules that are going to enslave us. FDA, NIH, CDC. CDC is making immigration policy now. I mean, it is the healthcare bureaucracy. And so we need to promote liberty and freedom in healthcare. Yes. We need to promote, we need to get rid of the bureaucracy, get rid of government involvement in healthcare entirely.
Oh, that would be
because
amazing. Government
is using healthcare now to enslave us. They're doing it all over, and you're right, with limiting air flights. People aren't going to be able to work. I'm involved in a lawsuit actually suing de Blasio in New York City. And I made the point that it is discriminatory. It's a racist policy.
That's right.
Because a large number of African Americans in New York City are not vaccinated.
And they
so
don't
you
want
are
to.
discriminating against them.
They
you don't
are,
want to.
and they don't want to be forced to do it. I
Absolutely.
was there and saw how blacks had to sit outside while whites were inside, and it was a vivid picture of where we're going.
Wow.
Doctor, thank you so much for taking time to be with us, explaining it a little bit more. You got to come back next time you're in Washington, D.C. This was incredible for us to catch this incredible doctor because he happened to be in town to bring this information to you. Thank you, thank you, thank you, and I'll be right back with my panel. We'll kind of sort through the noise of this news and find truth right after this.
It's time for a cure. CURE is a coalition of new voices with new ideas that will become new policies. We are the CURE, the Center for Urban Renewal and Education. Headquartered in Washington, D.C., CURE works with churches, political, and business leaders on behalf of urban communities. CURE's mission is to address issues of culture, race, and poverty from a Judeo-Christian perspective. CURE. Join with us, and there has never been a better time to help Black communities.
So glad the Bible says, fear not, don't be afraid. I'm so glad that we have my panel and the doctor to try to help us sort through some of these questions on COVID, on vaccines. And I think that people were already working through in their personal lives what they were going to do, and most did it. They went and got the vaccine. But when forced came on the table, things changed rapidly. So Horace, thank you for staying with me. I forgot that you've also worked in constitutional government. And Mike, we've known each other so long, you probably have a long resume. resume I forgot about. And you too, Rick. Thanks for reminding me that you're also in government. Now he's Americans for Limited Government. And maybe because you were inside.
Maybe.
Maybe. And then Roger, thank you for being with us. Severino, you're at the Ethics and Public Policy Center now, but you've also been inside of the administration over at HHS, which is Health and Human Services, guys. He's an expert. He's in the Civil Rights Division there. And so people have a lot of questions, but yet they're not finding answers. So I don't want to ask round robin. I want you guys to help me discuss for our audience and our viewers how they can get to the answers that they're looking for, because people are being shamed. And the minute they ask a question, you brought up on the break Nicki Minaj. I talked about her in the opening and how the minute she just says, hey, I heard some stuff, we can't even hear stuff now. Immediately you're shouted down. And then as the doctor told us that, or you're forced out of giving alternatives. So Roger, how do we get to the place that, we don't have to necessarily go to disparate impact in the courts to be free? And people being able to make their own health decisions.
And it starts from the top, right? President Biden has been lecturing the American people,
right.
not speaking to them as equals, right? It should be a family type discussion, not these are the rules, these are the orders, and shut up and do what we say. And that's unfortunately the message we've gotten. Biden says he's run out of patience with the American people. And that has effects down the line of the shaming and the censoring, and it's gonna spread around. And when people aren't convinced, and they still have questions, being shouted down is going to make them bunker down and more resistant. We try to persuade our fellow citizens, not force them.
Well, and that's what's happening. Now you got BLM in the streets, and it's just like, uh-oh, are we going to have another end of summer love again? Because this is going to disproportionately affect minorities.
And it's interesting that one of the quotes out of the BLM leadership was talking about how they can't trust the Democrats or the Republicans. Quite a shot to the Democrats, which are highly dependent politically on black votes. So it's really a political problem for Democrats. But I think there's
a week of the Haitians showing up at the border.
Well, I think there's another. I think there's a fundamental kind of ethos though that's under attack, and that's the idea that I go to my doctor, I have a discussion with my doctor about what my health is. We make a decision jointly about how to treat it, and we go off and we treat it. And what might be right for me might not be right for Roger, might not be right for Horace, might not be right for you. But what the federal government's trying to do is they're trying to say one size fits all. We're not going to allow treatments. We're not going to allow any of those things. We're going to force you to get a vaccine, even though people now know, because of breakthrough cases, the vaccine isn't 100%. And they know that
even if you already had COVID and you have natural immunity.
Well, that's another area that they're not even letting people talk about.
And that's the key. People know, because the government no longer controls the lines of communication, and the influencer network from Washington, D.C. has been decimated by this. When they destroyed the influencer network under Donald Trump, they're eating that. They're now digesting the results of that. And so because influencers like Nicki Minaj sit there and say, I don't like this, that has far more influence than a Surgeon General standing up in a white coat talking from a bureaucratic standpoint. And that's their problem.
Well, are we going to see any shift in this? Because not just politically, but it seems it's not going away. The Biden administration is in trouble, Horace, because blacks are still saying, you're not forcing me. I might have to be unemployed. And I think that when New York decided, well, we're going to take a step further and just demand that you have to start showing these vax cards. I mean, our history's already, you mentioned Tuskegee. How about having to show papers to be mobile?
Well, back when YouTube was completely and totally free and people could see anything that got posted, there were regularly, and I'm just talking about in the Bush and in the Obama administrations, there were regularly these videos where people were asked questions, people who happen to be black, about various public policies in which they just flipped who the parties involved were. So if it was something critical that Obama had done, they just said it was George Bush, or they said it was John McCain, and vice versa. And you saw these black Americans all say either it's great when they thought that it was Biden, or terrible when they didn't know that it was Biden and Obama. We are now seeing today with our own eyes, not on YouTube, that there are real things happening, like people getting kicked out of restaurants, or the President of the United States telling us that his patience has just worn thin.
Yes.
One of my cousins sent me a TikTok video of a black woman saying, "Who does this man think he is, telling me that my patience has worn thin? He doesn't pay my bills.
Wow.
He isn't running my house.
Yeah.
Who is he?" Now, he said a bunch of other things that this audience probably doesn't like to hear, but what she meant was seeing it for real is not the same as the perception that the Democrats are our friend, that progressives really are good for black Americans. This is going to lead to a big cultural break, not just a political break, a cultural break.
And I hope so, because blacks have been talked into just accepting a reality that the feds are their friends. And I think that even on the question that you guys were talking about, the freedom, and whether this is the reason that we're seeing the difference in the community reaction, but fear is driving a lot of African Americans. And when you got fear on the table, they don't want to hear things like you better. And in fact, I was in New York on the 9/11 weekend when the rule went into place, and I was just like asking one of the restaurant owners, I'm like, well, okay, so you're going to leave all the black folks outside while the white folks are inside, but what about your workers? And they were like, we don't know what we're going to do. I asked at my hotel, what are you going to do? They were like, we don't know, but that following Tuesday was when the rule went into place, and now the end result is they're riding up there in the streets. Where do we go? How are people going to be able to sort through the decisions they need to make? They're not going to vaccinate. We kept hearing, if we reach herd immunity, Well, we've reached it. We've got people
well beyond it.
We've got the antibiotics. We've got antibodies. We've got people that are vaccinated. So why this push? What is really driving that we're going to force your hand and make you do something that you don't want to do in the Latino community or the black community, and even in the white MAGA community?
There's a lack of trust, right? If you don't trust the people who are giving the orders, you're going to resist.
Right.
And that comes from not being forthcoming with, where is this all going to end?
Yes.
If the government doesn't say with clarity, if we reach this benchmark, it's over. We have won. We go into a war, you have set objectives.
Yeah, but they've been moving that goal.
That's
they
the key.
keep moving the goalposts. And it's disproportionately hitting the minority communities because our kids are out of school. So go ahead. Yeah. But you're right, they don't trust.
So now it's first bend the curve, and now it's Delta, okay?
Right.
Delta's real.
So it's going to be something else.
Yes, it is.
However, if you keep moving the goalposts, people are going to start wondering, is this just about power? And once people get power under emergencies, they will tend to keep it. And here's one thing I had to fight at HHS. There were folks inside who wanted to suspend enforcement of our civil rights laws during COVID when it came to administration of the vaccine.
Wow.
I kid you not. I had to fight against that. That is the risk.
And that quickly,
of power.
even though they didn't even know where we would be today. So you're telling us that in this, before they even knew where we were going, they're already grabbing that kind of power. This is not a happy scenario right there, because people aren't going to then trust. And when they don't trust, they even shut down more.
Let's go to the federal workforce, because you brought it in the previous session. And the disproportionate number of blacks and Hispanics that are in the federal workforce, particularly blacks. And so what they have is they're going after the lower paid federal employees and saying you must be vaccinated or else. Now those are the union federal employees. Those are the civil service employees that are covered, but the unions represent.
That's right.
Typically, GS 12 and below.
That's right.
For those of us in DC. And so there's and so the key here is going to be a real fight between the public employee unions trying to enforce civil service laws, which do not allow people to be fired for this.
That's correct.
And it's going to be, and so the test will once again be the Biden administration trying to break the civil service laws of this country in order to fire blacks.
Okay.
That's right.
Well,
That's
is this bubbling? Or is this going to happen? I mean, or is the administration going to start backing up because they're starting to see?
Well, it depends on
what happened in New York. That's just a little sampling of what could happen all across the country.
Largely on their broader agenda, but I want to amplify a little bit about this. People have falsely been looking at blacks as monolithic. Oh, they're all supporting the left wing. They're all supporting the Democrats. They're all woke. There is a bifurcation between the higher educated, higher income, and even middle class, and those who are not. Guess what? The largest number of black Americans are not in the higher educated, not in the higher income, and those folks are not happy to see that their spokesman come from that elite group, and they're making claims and assertions that do not represent them. I repeat, there is a conflict here that is coming. It's cultural and it's political.
Now, are you implying that goes beyond Biden and to Kamala Harris? Because she is elite, and she's the one that first said, don't do this, and now she's out there saying, please do it, and they're paying people to do it, and they're not. And you're also making me think about the governor from Mississippi was in the hot seat on this issue, and you have too many COVID numbers, and yet we know that his state are these exact people you're describing, Horace, of all racial backgrounds. They keep trying to pretend this is about MAGAites, this is about Trump people, and yet undercover they're trying to. I don't think they expected it to blow up like this.
Well, they were used to being able,
like this.
They were used to being able to talk to the specific segments that they needed to talk to. If they wanted to talk to high-income people, they could go on NPR. If they wanted to talk to some people on Facebook, they could then create certain groups. What is increasingly happening when you lose your job, when someone gets kicked out of the restaurant and it's being shown all over the place, everybody is seeing this, and they're not able to get a message targeted the way that they want. It is very clear, and there are white Americans that say, how dare you kick these black people out? How dare you have your major event at the Met Club and only the brown and black people have to wear the mask, and all of the elites that paid the $30,000 for the ticket don't have to wear the mask.
And what about this week, Broadway opening, and then no one, it'll be all white inside? But I want to get back to Roger, because you brought up the Latino community, and I'm fascinated because we're not hearing much upground. This happened to get on the front page. Blacks have been rumbling about it in their own private circles since it started. But in this particular community, you've said a couple of times this trust of government. Generally speaking, I don't see the Latinos trusting government. So maybe that's a bigger factor than fear, that they're coming from countries that already said the government is not my friend.
Yes, that's right. If you come from countries where you have an inherent distrust of government, it's going to spill over. So you got to build those bridges. And the Latino community, a large proportion is working in those service industry jobs. They're the ones out there on the front line, so to speak. So we gotta actually address them where they are. Also, you have people of faith as well in the Latino community, right?
That's true. I want to get to that one too.
There is a question. Okay, so there are some who have religious objections due to the vaccines being developed or tested on aborted fetal cell lines, right? And they don't want to put that in their body. There has to be space for people to have dissent on these issues of conscience.
Because that was a big deal. Even when they started the testing, they're like, you guys are using abortifacients in this?
Fetal cells. Those sperm abortions in the 60s have replicated up till today, and they're using that in research. They don't have to. They can use alternatives, but they've brought it forward. Are people going to be allowed to say, please give me space because of my own conscience?
And why won't they give space? Why does it have to be the vaccine? When and the doctor just told us that he's been using things and it wasn't, and it was working. Oh my goodness, I'm going to run out of time.
Power and control. Straight power and control. It's because we said so. When Joe Biden says, I'm losing my patience, that tells you everything. This isn't about your health. This isn't about, different ways to get treatment. This isn't about the health of the American public or even about COVID. It's about power and imposing power from Washington, D.C. on the individual lives. And when they come back to you and they say, now we need to do socialized medicine, national health care, remember this, because this is how national health care works.
Okay, you heard a lot that hopefully did not confuse you, got you a little bit more insight. Make your own personal decisions about what you and your family need to do, and keep in mind that God hasn't given us a spirit of fear.
That's right.
Power, love, and a sound mind. Government doesn't have the power over our personal decisions. I'll see you next week here on Cure America. Thank you, panel, and thank you, Dr. Armstrong, for putting the truth out there in the public square.